The fluorescent lights hum overhead, a constant drone that never stops. It drowns thought, drowns conversation, drowns everything except the smell of antiseptic and burnt coffee, and something older underneath. The residue of bodies breaking down faster than hands can repair them. County General Emergency Department. 6:47 in the morning. Dr. Elise Carver moves through it like a ghost. Mid-30s. Hair pulled back tight enough to ache. Scrubs washed so many times the blue has faded to something closer to gray. She doesn't look up when she walks. Doesn't speak unless someone asks a direct question. No one asks. She's a trauma fellow, second year. The kind of quiet that makes people forget she's in the room. The residents whisper she's too old to still be training, that she must have washed out somewhere else and started over, that maybe she's just not good enough. They don't bother lowering their voices anymore. She stocks supply carts in the corner, counts IV bags with the same methodical precision she applies to everything, refills glove boxes, checks intubation kits. Her hands move without hesitation, without thought. Behind her, 2 residents lean against the nurse's station, coffee in hand, confident in a way only the young and untested can be. The male one, Jenkins, surgical track, top of his class at Hopkins, glances her way and smirks. 6 months here and she's still doing scut work. The woman beside him, Patterson, sharp and ambitious, doesn't even look up from her tablet. Maybe that's her ceiling. Jenkins snorts into his coffee. Didn't she go to some Caribbean school or something? State school, same difference. They laugh, not cruel, just casual, the kind of dismissal that doesn't even register as unkind because it never occurs to them she might hear. Elise's hands don't pause. She finishes the inventory, marks the checklist, moves to the next cart. Her wrist catches the light as she reaches for a box of catheters. A watch. Old, military issue. Analog face behind scratched crystal. Fabric strap worn thin and frayed at the edges. The kind no one wears anymore. Not when smartphones tell time. Not when smartwatches track every heartbeat. Patterson notices, raises an eyebrow. Nice watch. Goodwill find? Elise pulls her sleeve down without answering, keeps moving. Jenkins grins. Bet it doesn't even keep time. Patterson shrugs, already losing interest. Probably sentimental. Dead relative or something. They turn back to their screens. Elise walks past them toward the supply closet. An alarm cuts through the hum. Sharp. Insistent. Bed 4. Everyone freezes for half a second. That universal pause before action kicks in. Elise doesn't pause. She's already moving. Pulling the crash cart from its alcove before anyone calls for it. Her hands snap the brake. Angle is into position beside bed 4, and she steps back, just as the attending physician rushes in. Dr. Mehta. Senior attending. Good at his job. Likes protocol. He glances at the cart, at Elise, frowns slightly. Lucky timing. Elise nods once, says nothing. She steps back into the margins, invisible again. Mehta. FO runs the code. The patient stabilizes. Routine save. The kind that happens 3 times a shift in a place like this. Jenkins watches from the doorway, arms crossed. She's always in the right place at the right time. It's weird. Patterson taps her screen. Pattern recognition. That's all. She's been doing this long enough. Still weird. The code ends. The patient breathes on his own again. Mehta strips his gloves and tosses them in the red bin. He doesn't thank Elise. Doesn't acknowledge her. She's already gone. The supply closet is small, narrow, lit by a single bulb that flickers every few seconds. Elise closes the door behind her, leans against it, breathes. The noise of the department muffles here, fades to a dull roar behind thick walls. For 30 seconds, maybe a minute, she allows herself to stand still. Her hand drifts to the watch. Fingers trace the cracked crystal, a habit, unconscious. Muscle memory older than this job. Older than this version of herself. She closes her eyes. For just a moment, the hum of fluorescent lights fades, replaced by something else, something deeper. The thrum of rotor blades, the grit of dust in her throat. Voices cutting through static, sharp and urgent, calling for hands that could hold life together just a little longer. She opens her eyes. White walls, metal shelves, boxes of gauze and suture kits. The watch ticks. She takes one more breath, straightens, opens the door, steps back into the noise, back into the rhythm of a place where no one knows her name, and no one asks why someone with her skills works in the shadows. She prefers it that way, or she tells herself she does. The morning stretches ahead. More carts to stock, more shifts to fade into, more moments where her hands know exactly what to do and no one notices. The residents laugh at something on Patterson's phone. Jenkins elbows her, and they both look toward the attending lounge, plotting their next move up the ladder. Elise walks past them, invisible, the way she needs to be. The watch ticks against her wrist, steady, relentless, a reminder of a life she walked away from, a life that taught her how to save people and how to lose them. The trauma bay smells like iodine and sweat. 9:34 in the morning, and the teaching case rolls in on a gurney, conscious and loud. Male. Early 20s, shoulder visibly wrong, dislocated, anterior by the look of it. The attending, Dr. Russo, stands at the head of the bed with his arms crossed, watching, teaching. Jenkins steps forward, eager. This is his chance to show competence. Patterson stands behind him with a tablet, recording notes. Elise lingers near the wall, observing, silent. The patient writhes on the table, face pale and slick. It hurts. Jesus Christ, it hurts. Jenkins pulls on gloves. Tries for a confident smile. Just hold still, okay? We're going to fix this. Russo starts talking. Textbook reduction technique. 3 steps. Traction, rotation, repositioning. Jenkins nods along like he's done this 100 times. He hasn't. He grips the patient's wrist, plants his other hand on the shoulder. On 3. 1. He pulls. Wrong angle. Too much force. The patient screams. Jenkins freezes. His hands shake. The shoulder stays out. I don't think... Russo steps forward, adjusting Jenkins' grip. Relax the joint first. Don't force it. But before he can demonstrate, Elise moves. Not fast, not frantic, just there. Her hand settles over the patient's wrist. Gentle, firm. Her voice is quiet, steady. Breathe. Look at me. On 3. Don't fight it. The patient's wild eyes lock on hers. She doesn't wait for approval. One smooth motion, traction with rotation, controlled, practiced. The shoulder slides back into place with a muted pop. The patient gasps. The screaming stops. Silence. Russo stares at her. Jenkins steps back, face red. That's not standard technique. Elise strips off the gloves she didn't ask permission to wear. It worked. She drops them in the waste bin, walks out. Patterson watches her go. Where the hell did she learn that? No one answers. The locker room is empty at noon. Most of the staff eat in the cafeteria or grab something fast from the vending machines. Elise sits on the bench in front of her locker. A sandwich rests on her lap, half-eaten. She chews without tasting. The locker door hangs open. Inside, the usual. Stethoscope, spare scrubs, a protein bar she forgot about 2 weeks ago, and a photograph. Small, folded once, taped to the inside of the door. She doesn't look at it, but her hand drifts to the watch again. The same unconscious movement, tracing the edge of the crystal with her thumb. The door swings open. An older nurse steps in. Carol, 20 years in the ED, sharp eyes that miss nothing. She stops when she sees Elise. You move like someone who's done this before. Elise doesn't look up. Done what? Field work. Real field work. Silence. Elise takes another bite of her sandwich. Chews slowly. I stock supply carts. Carol studies her for a long moment. Then she crosses to her own locker, spinning the dial. Yeah, sure you do. She doesn't push, just gathers her things and leaves. The door swings shut. Elise exhales. Her thumb presses the watch face, hard enough to feel the glass resist. Her eyes drift to the photograph. She doesn't unfold it. Doesn't need to. She knows every face in that picture. Every name. Every one she couldn't save. The fluorescent bulb overhead flickers. For a moment. Just a moment. The room shifts. Desert night. The back of a transport vehicle. Metal walls slick with condensation and blood. Her hands, younger hands, steadier somehow, pressed into a soldier's abdomen. 19 years old. Face pale. Eyes glassy. Stay with me. Eyes on me. You don't get to leave. The hum of rotors overhead. Dust in the air. Someone shouting her name. Her old name. The one she doesn't use anymore. Doc. The locker room snaps back. White tile. Flickering light. Silence. Elise's hand trembles. She closes it into a fist. Forces it still against her knee. Breathes. Stands. Closes the locker. Walks out. The afternoon blows. Sutures. IV placements. A drunk who vomits on Jenkins' shoes. Russo lectures on sepsis protocols while Patterson takes his notes like her life depends on it. Elise restocks, observes, stays in the margins, but Carol watches her now. From across the bay, thoughtful. At 2:15, a minor car accident rolls in. Whiplash, contusions, nothing serious. Elise preps the exam room, lays out supplies with the same quiet efficiency. Jenkins walks past, stops, looks at her. That thing you did this morning, with the shoulder. Elise doesn't look up. Reduction, standard procedure. It wasn't standard. She straightens, meets his eyes. It worked. He hesitates, wants to say something, doesn't know what. Where did you train? State school. Which one? Does it matter? He frowns, uncertain now. I guess not. He walks away. Elise finishes prepping the room. Her hands don't shake. Her breath stays even. But the watch ticks, steady, relentless. A reminder that some things don't stay buried, no matter how deep you try to bury them. She pulls her sleeve down, goes back to work. The shift ends at 7. The night crew filters in. Handoff reports, patient charts, the rhythm of continuity. Elise gathers her things, walks toward the exit. Carol catches her at the door. You ever want to talk? I'm around. Elise pauses. About what? Carol just looks at her, kind, knowing. Whatever you're carrying. Elise's jaw tightens. I'm fine. Yeah. Carol nods. I believe you. She doesn't. Elise walks out into the parking lot. The air is cool, the sky bruised purple with dusk. She sits in her car for 5 minutes, hands on the wheel, engine off. The watch ticks in the silence. She closes her eyes, breathes, starts the engine, drives home. To an apartment where no one knows her name, where no one asks questions, where the past stays locked behind a closed locker door, or so she tells herself. The sirens hit first, 2 ambulances, back to back. The sound cuts through the mid-afternoon lull like a blade. 2:47. Shift change in an hour. Everyone tired. Everyone counting down. The bay doors explode open. Paramedics rush in. Voices overlapping. Radios crackling. Multi-vehicle collision. 3 critical. Blunt force trauma. Internal bleeding. GCS dropping on 2 of them. Chaos. Attendings converge. Russo takes command, pointing, dividing resources. Jenkins and Patterson sprint to opposite gurneys. Nurses swarm with equipment. Elise stands near the supply station, watching. Gurney 1, male, 40s, chest trauma, breathing shallow. Lips tinged blue. Russo moves to him, stethoscope already out. Breath sounds absent on the left. Pneumothorax. Get me a chest tube kit. Jenkins grabs the kit, hands shaking slightly. He's practiced this on simulators, watched it done twice. Never performed it himself. Russo steps back, giving him space. You've got this. Talk me through it. Jenkins nods, tears open a kit, lays out the instruments. The patient's oxygen saturation drops. 92, 89, 86. I need to find the 5th intercostal space. His hands hover, uncertain. 83, 80. Jenkins now. I'm trying. 79. Elise moves. No announcement. No permission. She crosses the space in 4 strides, pulls on gloves, takes the scalpel from Jenkins' frozen hand. Her voice is calm, steady. You're going to feel pressure. Stay still. Her fingers palpate the ribcage, find the landmark in 2 seconds. She marks it with her thumb. Incision. Clean, controlled. Hemostat to spread the tissue. Tube insertion. Smooth, practiced. A hiss of air escaping fills the bay. The patient gasps. Color returns to his face. The monitor climbs. 84, 90. 96. Russo stares at her. Where did you learn to do that? Elise strips the gloves, drops them. Textbook. She turns away before he can respond. Gurney 2, female, late 20s, pale, abdomen rigid, blood pressure dropping fast. Patterson and Dr. Maida work over her. IV lines, fluids running wide open. Maida's face is tight. She's got internal bleeding. We need to get her to OR. Now. He reaches for the phone to call upstairs. The monitor alarms. Blood pressure 70/40, dropping. Elise's voice cuts across the noise. She won't make it upstairs. Everyone stops. Maida turns. Excuse me? Her pressure's too low. She'll arrest in the elevator. We have protocol. She'll be dead in 3 minutes. Maida's jaw tightens. What are you suggesting? Elise doesn't hesitate. Resuscitative laparotomy, here. Silence. Maida stares at her like she's lost her mind. That's not standard of care in a... She's dying now. The monitor drops again. 65/38. Maida looks at the screen, at the patient, at Elise. You've done this before. It's not a question. Elise meets his eyes. Yes. He hesitates one more second, then nods. Do it. Elise moves. She preps the abdomen. Betadine in fast strokes. Drates pulled from the crash cart. Scalpel in hand. Her movements are different now. Faster. Precise. No hesitation. She makes the midline incision. Blood wells up immediately. She packs the cavity with lap sponges, suctioning, searching for the bleeder. Patterson watches, frozen. Oh my God. Elise clamps the vessel, ties it off, packs around the liver. The bleeding slows, stops. The blood pressure stabilizes. 70/45, 80/50. Maida exhales. Get her to OR, now. The team moves. The gurney rolls out. Elise stands at the sink, scrubbing blood off her hands. Her face is blank, controlled. Russo approaches, stops beside her. That wasn't taught in any fellowship I know. Elise doesn't look at him. It worked. That's not an answer. She dries her hands, drops the towel. It's the only one I have. She walks out of the bay. The hallway is cooler, quieter. Elise leans against the wall, closes her eyes. Her hands shake now, just slightly. She presses them flat against the concrete, forces them still, breathes. In, out, in. Footsteps approach. Carol stops a few feet away, watching. That wasn't luck. Elise doesn't open her eyes. No. And that wasn't something you learned here. Silence. Carol steps closer. Her voice is softer now. I don't know where you came from, and I won't ask. But whatever you're running from, it's still ill inside you. Elise opens her eyes. I need air. She pushes off the wall, walks toward the exit. Carol watches her go. Behind them, the trauma bay is still chaos. Orders shouted, monitors beeping, lives hanging in balance. But Elise walks away from it, out into the late afternoon sun. She sits on the curb outside the ambulance bay, head in her hands. The watch ticks on her wrist, steady, relentless, a countdown she can't stop. Inside, Russo and Maida stand together near the nurses' station, talking quietly. She's not just a fellow. No. So what is she? Maida shakes his head. I don't know, but we just watched her save 2 lives with techniques most trauma surgeons wouldn't attempt outside an OR. Russo crosses his arms. We need to know who she is. Maybe she doesn't want us to know. Too late for that. Jenkins approaches, still pale. Is she... where did she... Patterson cuts him off. Does it matter? She saved them. Jenkins looks toward the exit, toward the figure sitting alone on the curb. Yeah, she did. He walks away. Patterson watches Elise through the glass doors. Something happened to her. Carol nods. Something big. Outside, Elise lifts her head, stares at the horizon. The sun is starting to set. Orange bleeding into purple. She takes a breath, stands, walks back inside, back into the noise, back into the chaos. Because no matter how far she runs, no matter how invisible she tries to be, the work finds her. The skills remain, and the past never stays buried, not when lives are on the line. The shift ends at 7. Elise changes into street clothes, jeans, plain shirt. She pulls her jacket on, zips it halfway. The watch stays visible on her wrist. She walks toward the exit, needs air, needs distance. The hallway is empty. Most of the day staff already gone. Night shift settling in. A man steps into her path. 30s, buzz cut, civilian clothes, jeans, flannel shirt, work boots. But the posture is wrong for a civilian. Too straight, too controlled. He stops 3 feet away, studies her face. Then his eyes drop to her wrist, to the watch. He goes very still. Captain Carver. Elise freezes. Every muscle locks. Her breath catches. She forces her voice steady. You're mistaken. The man doesn't move, doesn't blink. No, I'm not. His voice is quiet, certain. Elise takes a step to the side, tries to go around him. He doesn't block her, just speaks again. 2011. FOB Salerno. She stops. You pulled me out of a burning Humvee, told me to stop screaming and start breathing. Her hand trembles. She closes it into a fist. I don't know what you're talking about. You reset my femur without anesthetic, kept me talking for 40 minutes until the medevac landed. Elise's jaw tightens. I think you have me confused with someone else. He tilts his head, studies the watch again. Your call sign was Catalyst. The name hits her like a physical blow. She closes her eyes, just for a second. When she opens them, her voice is barely a whisper. Please, don't. The man's expression softens, but he doesn't back down. I owed. Do my life then. Elise turns to walk away. Fast, he raises his voice. Not loud, just enough. Sergeant First Class David Ortiz, 75th Ranger Regiment. Footsteps. 2 residents round the corner. Jenkins and Patterson. They stop cold. Stare. Ortiz keeps his eyes on Elise. That watch you're wearing. That's a Valor award, isn't it? Elise doesn't turn around. Her shoulders rise and fall, breathing too fast. Patterson's voice quiet, confused. What's he talking about? Ortiz finally looks at them. You've been working next to a combat surgeon. Silver Star recipient. 3 tours. Over 200 lives saved under fire. Silence. Jenkins' mouth opens. Nothing comes out. Ortiz steps closer to Elise, lowers his voice again. I owed you my life then. I owe you respect now. He nods once, a gesture of honor. Then he walks past her, down the hall, gone. Elise stands frozen. Patterson stares at her. Is that true? Elise doesn't answer. She pushes through the exit door, into the parking lot. Behind her, Jenkins and Patterson exchange a look. Did he just say Silver Star? Patterson pulls out her phone, starts searching. Catalyst, combat surgeon, 2011. Her eyes go wide. Oh my God. The parking lot is dark. Sodium lights casting orange pools across cracked asphalt. Elise walks fast, doesn't run, refuses to run, but her breath comes hard, shallow. She reaches her car, fumbles with the keys, drops them, bends down, picks them up. Her hands shake so badly she can barely fit the key in the lock. She gets the door open, sits inside, closes the door. Silence. She grips the steering wheel, knuckles white, breathes, in, out, in. The watch ticks. She looks at it, really looks at it. The crystal is cracked, the strap is frayed, the face is worn almost smooth. But engraved on the back, barely visible now, are 3 words. For valor, perseverance, life. She presses her thumb against the inscription, closes her eyes. Inside the hospital, the word spreads. Patterson shows Jenkins her phone screen, an article, a photo, a younger Elise in uniform, standing with 4 soldiers, desert in the background, all of them smiling. She was deployed to Helmand Province, ran a forward surgical team. The article says she performed over 300 emergency surgeries in 18 months. Jenkins scrolls down. Silver Star for pulling a wounded soldier out of a firefight and operating under fire. Carol appears behind them, looks at the screen. Her face doesn't register surprise. I knew it. Patterson looks up. You knew? Not the details, but I knew she wasn't just some washed-up fellow. Russo joins them, reads over their shoulders. Why didn't she tell anyone? Carol crosses her arms. Would you? If you'd seen what she's seen? Silence. Maida walks up, takes the phone, reads. His face goes pale. She left service 4 years ago. Honorable discharge. No reason listed. Patterson scrolls further. There's a mention of a mass casualty event. 40 wounded in one night. She worked for 16 hours straight. Russo's voice is quiet. And then she came here, to stock supply. Like carts. Jenkins shakes his head. Why? No one answers, because none of them know. The cafeteria is emptier now. Dinner service winding down. Word spreads. Nurses whisper. Orderlies talk. The story grows with each retelling. By the time the night shift hears it, Elise Carver has become a legend, a ghost, a hero hiding in plain sight, and no one knows why. Elise sits in her car for 20 minutes. Finally, she starts the engine, drives home, to an apartment she barely furnished, to a life she built on silence. She unlocks the door, steps inside. The space is small, clean, impersonal. A couch, a table, a single chair. No photos on the walls, no personal touches, nothing that says who she is or who she was. She drops her keys on the table, sits on the couch, stares at the wall. The watch ticks in the silence, steady, relentless, a reminder of every life she saved and every life she lost. She pulls her knees to her chest, closes her eyes. And for the first time in 4 years, she lets herself remember, not in flashes, not in fragments, but fully. The weight of it crashes down, all at once, and she sits in the dark, alone, breathing, still here, still carrying it. Because some things don't fade, some things don't heal. They just become part of you, woven into bone and breath, until you can't tell where the past ends and the present begins. She opens her eyes. The room is dark. The watch glows faintly in the shadows, still ticking, still counting, still reminding her that she survived. And survival means carrying the weight, every single day. Elise doesn't sleep. She sits on the couch until the sky turns gray. Then she showers, dresses, drives back. The hospital feels different when she walks in at 6 a.m. Eyes follow her. Conversations stop mid-sentence. People stare. She keeps her head down, moves toward the locker room. Carol intercepts her near the nurse's station. "You okay?" Elise doesn't look at her. "Fine." "You don't look fine." "I'm here. That's enough." Carol watches her walk away. The locker room is empty. Elise changes into scrubs, pulls her hair back, stares at her reflection in the small mirror inside her locker door. She looks tired, older than 35. She closes the locker, heads to the trauma bay. The morning is quiet, a few minor cases, nothing critical. Russo approaches her near the supply station. "We need to talk. I'm working." "Elise." She stops, turns. His face is serious, not angry, just careful. What happened yesterday, what Ortiz said, doesn't change anything. It changes everything. She meets his eyes. "I do my job. That's all that matters. You saved 2 lives using techniques most surgeons wouldn't attempt outside an OR, and now we know why. So we need to know who you are." Her jaw tightens. "I'm a trauma fellow. That's all you need to know." She turns back to the cart. Russo doesn't push further. But he doesn't leave either. The sirens start at 11:37. Multiple rigs. The radios crackle with overlapping voices. Mass casualty event. Bridge collapse. Estimate. Tim at 20. Critical inbound. More coming. The charge nurse runs into the bay. "All hands. This is real." The doors explode open. Gurneys flood in. One after another. Blood. Screaming. Chaos. Attendings scramble. Residents freeze. Too many patients. Too fast. The system breaks. Russo shouts orders, but his voice gets lost in the noise. "Someone get me a line on this one." Jenkins tries. Fails. The patient's veins are collapsed. "I can't find." "Move faster. I need help over here." Patterson's voice cracks. "BP's dropping. I don't know what to." Elise stands in the center of it, watching. The noise fades. Her breathing slows. She sees the bay differently now. Not a hospital. A battlefield. She moves. Her voice cuts through the chaos. Sharp, clear, commanding. "Stop." Everyone freezes. She points. "You. Airway on bed 3. You. Direct pressure on that femoral bleed. You. Get me 2 units O negative and a central line kit. Now." No one questions her. They move. She moves between patients like water. Fast, efficient, precise. Her hands don't shake. Her voice doesn't rise. She triages, directs, commands. This is who she was, who she still is. Jenkins watches her, stunned. She's running the whole bay. Patterson nods, breathless, and it's working. Elise stops at bed 7. Young male, chest trauma, tension pneumothorax. She doesn't ask permission. Chest tube in 90 seconds. Bed 4, abdominal bleeding. She preps for laparotomy. Russo assists without being asked. Bed 9, airway compromise. She intubates in 1 attempt. The monitors stabilize. One by one, the chaos becomes order. And then, a sound. Rotors. Everyone looks up. The bay doors open. 4 soldiers step in. Dress uniforms. No weapons. Crisp. Formal. Behind them, a colonel. Army. Silver oak leaves on his shoulders. Ribbons across his chest. He scans the bay. His eyes find Elise. "Dr. Carver." Elise freezes. Her hands still gloved, still bloody. "I'm in the middle of..." "We have a convoy incident. 15 wounded. They're inbound to a field hospital outside the city. We're requesting your assistance." Silence. Every eye in the bay is on them. Elise strips her gloves. "I don't serve anymore." The colonel steps closer. "You're still IRR. Individual Ready Reserve. Your contract doesn't expire for 2 more years." Her face goes pale. "I didn't think you'd call." "We don't, unless it's critical." He holds out a tablet. Orders displayed on the screen. Voluntary recall authorization. You can refuse, but those 15 soldiers can't. Russo steps forward. She's in the middle of a shift. We have patience. The colonel finally looks at him. She's also the only trauma surgeon within 50 miles who's worked under fire. If you want to save civilian lives tonight, let her save theirs first. Russo's mouth closes. Elise stares at the tablet, at the names listed, the injuries, the clock ticking down. Her hands tremble. She looks at the watch, then at the soldiers standing at attention behind the colonel. What's the window? 30 minutes. After that, survival rates drop to single digits. She closes her eyes, breathes, opens them. I'll need a team. The colonel nods. You'll have one. He looks at the residents, at Russo, at Meta. Anyone here who wants to save lives tonight, you follow her orders. No questions. Jenkins steps forward immediately. I'm in. Patterson follows. Me too. Carol pulls off her scrubs. I've done field nursing. I'll go. Russo looks at Elise. You sure about this? She meets his eyes. No, but I'm going anyway. The colonel gestures toward the door. Transport's waiting. Elise walks toward the exit. The residents follow. The soldiers fall in behind them. As they leave, the remaining staff stands in stunned silence. Meta shakes his head. What just happened? Carol, still standing near the doorway, watches them go. She went back. To what? To who she really is. Outside, 2 military vehicles idle in the ambulance bay. Engines running. The colonel opens the door. 30 minutes. Let's move. Elise climbs in. Jenkins and Patterson follow. The doors close. The vehicles pull away. Fast. Inside, Elise sits in silence. Her hand rests on the watch. Jenkins looks at her. You okay? She doesn't answer, just stares out the window. At the city passing by. At the life she tried to leave behind. Coming back. Whether she's ready or not. The rotors thrum overhead. The convoy moves. And Elise Carver goes to war. One more time. The field hospital is a converted warehouse on the outskirts of the city. Temporary, functional. Lights rigged overhead. Sterile field prepped. 15 soldiers on gurneys. Some unconscious, some screaming. Elise steps inside. The noise hits her first. The familiar chaos. The sounds she spent 4 years trying to forget. She doesn't freeze. She moves. Her voice is different now. Harder, clearer. The voice of someone who commanded under fire. Triage. Red tags to the left. Yellow to the right. Black stays where they are. Jenkins hesitates at the first gurney. Young soldier, maybe 20, not breathing. Is he? Black tag, move on. Jenkins stares at the body, but Elise's voice cuts through. He's gone. The others aren't. Move. Jenkins swallows hard, tags the soldier, moves to the next. Elise works through them. Fast, methodical. Red, red, yellow, red, black. No hesitation, no emotion, just brutal efficiency. Patterson watches her, shaken. How do you just... Decide? Elise doesn't look up. You decide based on who you can save, not who you want to save. She finishes triage. 10 reds, 3 yellows, 2 black. Reds first. Set up 2 tables. We work in parallel. Carol preps the surgical field. Pulls instruments. Her hands steady despite the chaos. The first patient is wheeled in. Shrapnel wounds. Chest and abdomen. BP 70/40. Elise scrubs, gowns, gloves, steps to the table. Her hands move without thought. Muscle memory taking over. Incision, clamps, suction. She works in silence. No wasted movement. Jenkins assists. Tries to keep up. Retract here. He does. Suction. He suctions. She finds the bleeder. Ties it off. Moves to the next. 20 minutes. The patient. And stabilizes. Next. The night blurs, patient after patient. Blood and steel and the steady rhythm of survival. Elise doesn't stop. Doesn't slow. Her hands are extensions of her will. By 3 a.m, 10 are stable. 3 didn't make it. She stands outside the warehouse, alone. Her hands are clean now, but she can still feel the blood, still smell it. The colonel approaches, stops beside her. You haven't lost your edge. Elise stares at the horizon. I lost everything else. Silence. He waits. She finally speaks. Voice quiet, raw. There was a patient, 19 years old. IED blast. I worked on him for 40 minutes. Did everything right. Everything. Her hands close into fists. And he still died. Right there in my hands. The colonel says nothing. I looked up, and there were 12 more just like him. Bleeding, dying, and I couldn't. Her voice cracks. I couldn't be enough. She turns to face him. So I left. I thought if I worked somewhere people didn't die every day, I could forget. Did you? No, he nods slowly. That 19-year-old, he'd be proud of what you did tonight. Elise closes her eyes. 10 saved, 3 lost. That's not enough. It never feels like enough, but it's everything to the 10 who lived. He pulls an envelope from his jacket, hands it to her. New orders, your own unit, your own rules, full autonomy. You train the next generation of combat surgeons. She stares at the envelope. You don't have to answer now, but think about it. He walks away. Elise stands alone in the pre-dawn gray, holding the envelope, feeling its weight. Inside the warehouse, Jenkins sits on a crate, head in his hands. Patterson sits beside him. I tagged a black, a kid, maybe younger than me. Patterson doesn't answer, just sits with him. Carol approaches, hands them both water bottles. First time's the hardest. Jenkins looks up. Does it get easier? No, you just get better at carrying it. She looks toward the door, toward Elise standing alone outside. She's been carrying it for years. The sun rises at 6:14. The team loads back into the vehicles, quiet, exhausted. Elise sits in the back, staring at nothing. Jenkins sits across from her. Thank you. She looks at him. For what? For showing us how to do this, how to keep going. She studies his face, sees the change in him, the weight he'll carry now. You did well tonight. He nods, looks away. The convoy drives back to the hospital. When they arrive, the day shift is starting. The trauma bay is full again. Regular chaos, regular emergencies. Elise walks through the doors. The staff stops, stares. Russo approaches. How many? 10 saved, 3 lost. He nods. You brought them all back. He gestures to Jenkins and Patterson, both exhausted, but standing. That's what matters. Elise looks around the bay, at the familiar space. The place she's hidden for months. It feels different now, smaller. Russo steps closer, voice low. I'm sorry. She looks at him. For what? For not seeing you, for letting them treat you like you were nothing. I wanted to be nothing. Why? She's quiet for a long moment. Because being someone cost too much. She walks to the locker room. Patterson follows. Inside, Elise sits on the bench, exhausted. Patterson sits beside her. I looked you up, after Ortiz told us. Elise doesn't respond. Silver Star, 3 tours. You saved over 200 soldiers. I lost 43. Patterson goes quiet. You remember all of them? Every single one. Elise opens her locker, stares at the folded photograph. Patterson sees it. Can I ask? Elise unfolds it slowly. 4 soldiers, smiling, desert background. Elise is in the center, younger, different. My team, Helmand Province. She points to each face. Cortez, Daniels, Sam, Rodriguez. Her finger stops on the last face. Rodriguez was 19, the one I told the colonel about. Patterson's voice is soft. I'm sorry. Elise folds the photo, puts it back. Me too. She stands, closes the locker. I need to go home. Patterson nods. Elise walks out. Carol waits by the exit. You gonna take it? Take what? Whatever the colonel offered you. Elise stops. I don't know. You should. Why? Carol crosses her arms. Because you're not meant to hide. You're meant to lead. Elise looks at her. I'm tired of losing people. Then teach others how to save them. Elise walks out into the morning light, gets in her car, drives home. The envelope sits on her passenger seat, unopened. She parks, sits in silence. Finally, she picks it up, opens it, reads. Her hands shake. She closes her eyes, breathes. And for the first time in 4 years, she lets herself consider it. Going back. Not to hide, but to fight. In the only way she knows how. By saving lives, one at a time. Until the count of the lost is balanced by the weight of the saved. She folds the letter, gets out of the car, walks inside. The watch ticks, steady, relentless, still counting. 2 weeks pass. Elise walks into the ED at 7 in the morning, and everything is different. The residents stand when she enters. Not dramatically, just acknowledgement. Russo approaches, Netta beside him. Dr. Carver, do you have a minute? She nods. They walk to the conference room. The door closes. Inside, the trauma chief sits at the head of the table. Dr. Sandra Voss, 15 years running the department. Sharp, fair. Sit. Elise sits. Voss slides a folder across the table. There was an inquiry about the unsupervised laparotomy you performed 2 weeks ago. Elise's jaw tightens. I saved her life. You did. The patient's family sent a letter thanking you personally. Voss opens the folder, pulls out a second document. An Army colonel also submitted a very detailed endorsement, explaining exactly who you are and what you're capable of. Silence. The inquiry is closed. The board agrees you acted appropriately, given the circumstances. Elise exhales slowly. Voss leans forward. But that's not why you're here. She slides another folder across. We want to create a new position, Director of Emergency Trauma Services. You'd oversee mass casualty protocols, train residents and fellows. Lead high-risk cases. Elise stares at the folder. I'm not board certified for. We'll sponsor your certification, full institutional support, salary increase, and most importantly, Voss meets her eyes. Full autonomy. You train them your way. Russo speaks up. We saw what you did during the bridge collapse, and what you did at that field hospital. We need that here. Meta nods. You don't just save patients, you make everyone around you better. Elise looks down at the folder. At the title on the first page, Director of Emergency Trauma Services. Her hands rest on the table, on the watch. I'll need full control of training protocols. Voss doesn't hesitate. Done. And I decide who's ready for trauma. No politics. Agreed. Elise looks up. Then yes. Voss smiles. Small, genuine. Welcome aboard, Director. The word spreads faster than Elise expects. By noon, everyone knows. The atmosphere in the ED shifts, subtle but unmistakable. Residents approach her differently now. With respect. With questions. Jenkins finds her restocking supplies. Old habits. Dr. Carver? She turns. You don't have to do that anymore. You're an attending now. She looks at the cart, half finished. Someone has to. Let me. He takes the clipboard from her hands. Starts counting. She watches him for a moment, then nods. Thank you. Patterson approaches as Elise walks toward the trauma bay. Can I ask you something? Go ahead. Why did you stay quiet? Why not tell anyone who you were? Elise stops walking. Because I didn't want to be that person anymore. Why not? Because that person lost too many people. Patterson considers this. But you still saved more than you lost. Elise looks at her. The ones you lose weigh more. She walks away. 3 days later, the first training simulation begins. Elise stands in the trauma bay. 10 residents and fellows arranged in front of her. A simulation dummy on the gurney. Monitors hooked up. Realistic wounds applied. You have 2 minutes. Patient is a 25-year-old male. Motor vehicle collision. GCS 8. Hypotensive. Diminished breath sounds on the left. Go. They move. Fast. Coordinated. She watches. Silent. They secure the airway. Start fluids. Prep for chest tube. Jenkins hesitates at the incision site. 5th intercostal space. Mid-axillary line. Now. He makes the cut. Inserts the tube. Simulated air hisses out. Good. Next problem. The monitor alarms. Pressure dropping. Patterson calls it. Internal bleeding. Prepping for XLAP. You have 60 seconds before he arrests. Move. They move faster. Hands sure. Voices clear. Elise watches. This is different than surgery. This is teaching. Passing on what she learned in blood and fire. Making sure the next generation is ready. The simulation ends. Patient stable. Elise nods. Better. Again. They reset without complaint. Russo watches from the doorway. Arms crossed. Impressed. Carol stands beside him. She's a natural. She's been doing this her whole career. Just not in a classroom. Think she'll stay? Russo watches Elise correct a resident's hand position. Scission. Firm that patient. I think she finally found a way to fight that doesn't destroy her. 1 week later, a real mass casualty hits. Factory explosion. 12 critical. The ED erupts into controlled chaos. But it's different now. Elise stands at the center, directing, guiding. Bed 1, airway. Bed 3, chest tube. Bed 5, pressure on that bleeder until we get surgical. Her voice cuts through the noise. Steady, sure. The residents move like a machine, trained, confident. Jenkins intubates without hesitation. Patterson places a central line in under 2 minutes. Another fellow performs a chest tube under Elise's watchful eye. Good, secure it. Within 30 minutes, all 12 are stabilized. No one dies. Russo stands beside Elise as the last patient rolls to the OR. That was textbook. That was training. He looks at her. You did this. She shakes her head. They did this. I just showed them how. That night, the team gathers in the lounge, exhausted, proud. Jenkins raises a coffee cup. To Dr. Carver. Patterson joins. To the best teacher we never knew we needed. Elise sits in the corner, quiet, but she's smiling. Small, real. Carol sits beside her. You look different. How? Lighter. Elise considers this. Maybe. You decided about the colonel's offer? Elise nods. I turned it down. Carol raises an eyebrow. Really? I told him I'm more useful here, training the ones who will go after me. And he accepted that? He said he understood. That teaching is just another way to serve. Carol smiles. He's right. Elise looks around the lounge, at the residents laughing, at the team that's become something more than colleagues, at the life she built from the pieces of the one she left behind. Yeah, he is. 2 weeks later, the hospital holds a ceremony. Small, formal. Elise stands at the front in a pressed shirt and slacks, uncomfortable with the attention. Voss presents her with a plaque. Director of Emergency Trauma Services. The staff applauds. Elise accepts it, nods, sits back down as quickly as possible. After the ceremony, Ortiz appears at the door. He's in dress uniform, formal. Elise sees him, freezes. He approaches, stops in front of her, salutes. Wanted to see this for myself. You back where you belong. She looks at him. I'm not sure where I belong anymore. Yes, you are. He gestures to the residents gathered around her. To the staff watching with respect. You belong wherever you can save lives and teach others to do the same. He extends his hand. She shakes it. Thank you. No, ma'am. Thank you. He leaves. Elise stands alone for a moment. Then Jenkins approaches. Ready for the next sim? She looks at him. At Patterson joining them. At the team waiting. Yeah, let's go. They walk back to the trauma bay together. And Elise Carver, combat surgeon, Silver Star recipient, the woman who tried to disappear, finally stops hiding and starts leading, the way she was always meant to. 6 months later, the emergency department is different now, sharper, more efficient. The chaos still comes in waves, but the response is faster, cleaner. Elise Carver walks through the bay at 7 in the morning, coffee in hand, hair pulled back. The residents greet her with nods, respectful but comfortable now. She stops at the board, scans the patient list. 3 traumas overnight, all stable. Jenkins approaches. He's grown into the role, confident without arrogance. Morning, Dr. Carver. We've got a teaching case in Bay 3 if you want to observe. She nods. Lead it. I'll watch. He grins and walks off. Patterson passes by, tablet in hand. Department meeting at 9. They want your input on the new protocols. I'll be there. Patterson pauses. You know they're using your training model at 3 other hospitals now? Elise looks up. What? Voss submitted it to the state medical board. They approved it as a pilot program. She processes this. I didn't know. You're changing how we do this. Not just here. Everywhere. Patterson walks away before Elise can respond. Carol appears with a knowing smile. Told you. You're not meant to hide. Elise shakes her head, but she's smiling too. The afternoon brings a lecture hall full of medical students. Elise stands at the front. No notes. Behind her, a slide reads, Trauma Under Fire, Lessons from the Field. She speaks clearly, steadily. You will face moments where the system fails, where the protocol doesn't cover what's in front of you, where you are the only thing standing between a patient and death. The students listen, silent, focused. In those moments, you don't need permission. You need competence and courage. She pauses, looks at them. Medicine isn't about being fearless. It's about acting despite the fear. It's about doing what's right, even when it's hard. A hand raises. Young woman, 2nd year. How do you deal with losing patients? The room goes quiet. Elise considers the question. Honest. You don't deal with it. You carry it. Every single one. She touches the watch on her wrist, the gesture unconscious now. But you also carry every life you saved, and you let that be enough to keep going. The student nods slowly. Does it get easier? No. But you get stronger. The lecture ends. Applause fills the hall. Elise steps down. Students approach with questions. She answers each one patiently. This is the work now. Not just saving lives in the moment, but building the people who will save lives tomorrow. Evening comes. The ED is busy but controlled. A major car accident rolls in. 4 patients. 2 critical. Elise oversees but doesn't intervene. Jenkins runs the trauma. Patterson assists. Another fellow manages the airway. They move like a unit, precise, confident. Elise watches from the side, arms crossed. Russo joins her. You trained them well. They were always capable. They just needed someone to show them. You did more than that. You gave them something to live up to. She glances at him. They'll surpass me. That's the point, isn't it? She nods. Both patients stabilize. The team finishes without her needing to step in once. Jenkins strips his gloves, sees her watching. How'd we do? You didn't need me. That's how you. You did. He grins, tired but proud. Later that night, Elise stands on the hospital rooftop. The city spreads out below, lights flickering in the darkness. She breathes in the cool air, lets the noise of the day fade. Carol finds her there. Thought I'd find you up here. Elise doesn't turn. Needed some quiet. Carol stands beside her, looks out at the city. You've come a long way from stocking supply carts. Sometimes I miss it, the simplicity. You were never meant for simple. Elise smiles faintly. No, I guess not. They stand in silence for a moment. You ever think about going back? To the military? Elise shakes her head. This is where I need to be. The fight's different, but it's still a fight. And you're winning. We're all winning. That's what matters. Carol pats her shoulder and heads back inside. Elise stays a moment longer. She looks at the watch. The crystal still cracked. The strap still worn. But it still ticks. Steady. Relentless. A reminder of where she's been and who she's become. 1 year later. The trauma bay is full, organized chaos. A new class of residents moves through their rotations. Elise walks among them, observing, correcting, teaching. A young resident freezes during a procedure, hands shaking. Elise steps beside him, voice calm. Breathe. You know this. Trust your training. He nods, steadies, completes the procedure. She steps back. Good. Jenkins, now a senior resident, watches from across the bay. Patterson, finishing her fellowship, joins him. She's built something here. Yeah, she has. They watch her move through the bay. Steady, sure, no longer invisible, no longer hiding, just leading, the way she was always meant to. The screen fades to black. White text appears. Competence doesn't demand recognition, but it will always command respect. Another line. The greatest act of courage is not fighting the war. It's teaching others how to win it. Final line. Some people are born to lead. Others are forged in fire. And the strongest do both. The text fades. Silence. Then the sound returns. The steady beep of a monitor. The murmur of voices. The hum of a hospital that never sleeps. The sound of lives being saved. One at a time. By people who refuse to give up. Taught by someone who learned the hard way that survival isn't enough. You have to pass it on. Elise Carver stands in the trauma bay, watching her team work. Watching the future she built. The watch ticks on her wrist, still counting, still reminding her that every second matters, every life matters, and every person you teach carries forward the fight. She smiles, small, quiet, real, because she finally understands. She didn't lose herself when she left the war. She just found a new way to fight it. One student at a time. One life at a time. One moment at a time. And that is enough. The doors close. The shift continues. The work goes on. Because it always does. And now she's ready for it. Not as the person she was, but as the person she became. A teacher, a leader, a healer. Still carrying the weight, but no longer carrying it alone. The end.